Okay, we're going to talk about all things about men's skin today. So men's skin, as a general rule, is thicker and more resilient than women's skin. Now, that's not always the case, but their skin is oilier. It has more sweat glands in it because of all the hair follicles in their face. And that oftentimes leads to skin that can tolerate treatments better. It can tolerate stronger percentages of over-the-counter medications, as well as respond really, really well to treatments. So let's break that down a little bit more. First of all, what should men do for their skin? What they should do for their skin is very similar to what women should do for our skin. You want to use an antioxidant in the morning, like a vitamin C serum, and oftentimes men want one that is not very oily. So you want it to be lightweight, and there is a number of great options out there. A few that I really like is Pro Heal by SkinCeuticals is wonderful for oilier skin, and one that's really good for oily skin is the Silymarin antioxidant that just came out from SkinCeuticals. So after your vitamin C serum, then you want to put on a light oil-free moisturizer. And there are some great options there too. I love my face lotion, but that can actually be a little heavy for some male skin. The lighter face moisturizer from SkinBetter is a wonderful option. CeraVe, like their basic face lotion, is also a wonderful option. Everyone needs to have their face moisturizer different than their sunscreen. And if your skin is really oily, you don't even have to put a moisturizer on in the morning. But you do need to put sunscreen on every morning. And I would say it's hard for men to find sunscreen that they like because their skin is oilier. So oftentimes they feel like the sunscreen really sits on the top of their skin. One of the questions that came in is, are there any good tinted moisturizers for men that don't make you look like you have makeup on? And one of my favorites is made by SuperGoop, and it's called Zinc. And it kind of comes out a pinky tan color, but it blends really well with a lot of different skin types and doesn't feel heavy on your skin while still having more than 10% zinc. So that's your AM routine. You want to put on a vitamin C serum, you want to put on a light moisturizer, or you can skip the moisturizer if you have super oily skin, and then you want to always put on your zinc-based sunscreen. At night before you go to bed, you want to wash your face. I think it's really a common mistake for people to use, men in particular, to use a scrub or an anti-oil like benzoyl peroxide, salicylic acid face wash, and then to follow that with another treatment that actually over dries them out. So for your face wash, it really just needs to be something effective to get the sweat and the sunscreen off your face. Again, I love my face wash, but there's lots of other good ones out there. After the face wash, then you want to put on your treatment. And this is where men can oftentimes do a little bit more than women can. Now, it's good to understand that men's skin can tolerate higher percentages because their skin is oilier and their skin is thicker, so things don't penetrate their skin as well. So the end result is their skin gets less through it, which is why they need a higher percentage to get the result that they want. So for men, I oftentimes have them start with the 0.5% retinol or the prescription 0.05% tretinoin as their evening treatment. For people who want something that they can get over the counter, another great option for men's skin is their clearing serum by SkinBetter. Also has retinol in it, has glycolic acid in it, and a little bit of salicylic acid, which is really good to help with pores and making sort of the oil glands seem a little bit smaller. After you do your treatment step, you still need to use a moisturizer, even if you have really oily skin. You can use the same moisturizer you used in the morning. You can use that at night, but you do need to get a moisturizer on before you go to bed. That's the basics for men's skincare. So similar steps as for women, but sometimes we work in things that are a little bit helpful for larger pores like salicylic acid. Now, treatments. The two treatments that I do the most on men are neuromodulators, so that is Botox, Dysport, Jeuveau, and that helps with fine lines and wrinkles, particularly on the upper face, and IPL, Intense Pulse Light, which helps with red and brown. And both of those work really, really well. Neither have that much downtime. With Botox, if you don't get a bruise, really, you can't even tell someone's had Botox 20 minutes later. If you get a bruise, that can be hard for men because they don't wear as much makeup. There are more and more makeup out there that's available for men to help cover up bruising. A new brand that's pretty popular is called Disco, but you just, if you're gonna get Botox, which is totally fine, own the bruise, or get comfortable with a little bit of concealer because that is becoming more and more commonplace and it works really, really well. For IPL, that is used for like the red blood vessels around your nose and on your chin and like the brown spots we get from aging. When the treatment is done at Modern Dermatology, we tell people one treatment, you'll see a 50% improvement. And all of the lasering done at my office are done by board certified dermatologists. If you get it done at other offices, oftentimes they sell it in packages and you might need to do multiple treatments to get that result, but it is a very safe treatment. And for the couple days after the laser treatment, you're gonna notice that your skin might be a little bit red, it might be a little bit puffy, and then the brown spots will actually darken down and peel off, and that can take really more like 3 to 5 days. Now, the thing that is fascinating is that there are other treatments that male skin does exceedingly well with that I haven't talked about, and that's resurfacing. So these are things like the halo laser, the Fraxel laser, the CO2 laser, the erbium laser, and what that is when we drill holes into your skin to promote cell turnover. And when you have thick, oily skin, it can handle that drilling process really, really well, and it doesn't take very much work to make the skin turn over and build new collagen. I joke on me, my skin is so thin that I don't have that many fibroblasts to stimulate to make turnover, so I have to be really careful. But on a man, oftentimes their skin is twice as thick as mine. They can tolerate the treatment better. I don't have to use as high a settings, and I get really nice results. And so I've done a great deal of CO2 lasering on men. And the trick is giving them enough downtime that they can hide, because you really do need to hide for 5 to 7 days. But in addition to that, their skin is gonna look better a week later, but then it's gonna continue to look better. Like I CO2 lasered my husband 2 years ago, and I really think his skin continues to improve even though it's been 2 years since I did the lasering. So really, men, I feel like are being judged on their appearance, particularly in Seattle, just in the tech industry. And I wish that we all weren't judged on our appearance so much, but I do like the fact that now both genders are really thinking about this. And there's a lot of safe options for both genders to try out. And as I say every time, like, you need to find a provider who you trust, you can talk honestly with about your concerns, and then he or she can help you through figuring out which of these things you want to do, be it at-home treatments, be it just basic skincare, or be it more aggressive lasering and injectables. Thank you for all your questions. I am here to help, and I'm so appreciative of you guys paying attention. Thank you.